This is Dr. Neil Friedman from Israel Oncology. This is why it's so important to have an oncologist who is up to date on the latest treatments. Since 2005, there have been multiple new drugs approved for the treatment of cancer. This is just a list in the last 5 years. You can see there have been new treatments for thyroid cancer, lung cancer, lymphomas, breast cancer, pancreatic cancer, malignant melanoma, prostate cancer, breast cancer, multiple myeloma, colon cancer. In this column, you can see the improvement of the new drug compared to older drugs, the number of months a patient lived longer with the new drug, for instance, 10.8 months compared to 5.8 months, or 8 months versus 3 months for a new treatment of lung cancer. This is just a small sample of the improvements that have been made. And just in this year, 2015, there have been new drugs approved in multiple myeloma, breast cancer, thyroid cancer, a certain type of skin cancer, lung cancer, and a childhood tumor called neuroblastoma. I will just show a couple examples in breast cancer, an antibody for patients with HER2 positive breast cancer. Here, this is showing the improvement of the addition of the drug Perjeta to Herceptin and chemotherapy. This is the curve of the patients who received the new treatment. The survival was longer compared to those who did not receive Perjeta. Another drug, another antibody for patients with HER2 breast cancer, which was approved in 2013, compared to the previous standard treatment. Here you can see again in the blue curve the survival of these patients that received Kadcyla was longer than patients who did not receive that drug. The newest type of treatment in the field of oncology is immunotherapy, where antibodies are given to patients to block the immune system and therefore giving the immune system the ability to attack the tumor cells. These are called checkpoint inhibitors. I will show you one example. The drug nivolumab, which was just approved in 2015 for the patients with a certain type of lung cancer, patients that had previously been treated, that got the new drug, had a survival at 1 year of 42% compared to 24% of patients who received standard chemotherapy. This is another way of looking at that. The patients who received the new antibody nivolumab, if you look at these patients on the bottom, this is showing a decrease in the amount of their cancer. So that is why it is important to be up to date and to be using the right drugs if you have been diagnosed with cancer. At Israel Oncology, we are happy to help you obtain the right drug and the right treatment and give you all the information you need to receive the best cancer treatment possible.